My name is Anthony Wilson Robert Malilo. I am from Malawi. In the year 2000, I had a very bad car accident and I was operated upon in Malawi. About 3 months, I couldn't walk, and so I requested my doctor to seek a second opinion from another doctor. I had a friend, his name is Kelvin Mangisa, who had just returned from Manipal hospital. He had come for knee operations, both knees, and he advised me that he had had very good treatment at Manipal hospital. After everything had been set up, I traveled from Malawi to India. I arrived here on the 2nd of June, and upon arrival, I came straight to Manipal hospital. I was taken to Dr. Sunil Kini, who interviewed me, and after taking me for several x-rays and laboratory tests, he said that he could do the operation very well.
I first saw Mr. Anthony Malilo, a 76-year-old gentleman from Malawi, about 3 weeks back in the outpatient clinic. He came to me with increasing pain in the left hip for the past few years, but increased over the past 1 year to such an extent that he had to limp and could not walk long distances. To give you a brief history, he had a fall about 22 years back, sustaining a hip fracture which required surgery. After a couple of failed surgeries 3 months apart, the third and the surgery was done for a hip replacement which was inserted. In spite of the surgery, he had subsequent pain, and then a fourth hip replacement was required about 6 years back. So subsequently he was all right, but for the last 4 years he has again developed increasing pain in the left hip. I evaluated him to see that the left hip movements were actually painful. The pain was more situated around the groin as well as the upper thigh. We did x-rays to confirm that he had got a loosening of the implants of the left femoral stem, which subsequently had subsided, which indicated that it was indeed loose. So we told him that he would need a revision procedure wherein the components had to be changed to fit the prosthesis. So we did x-rays, CT scans and also blood tests to rule out any infection. The infection was subsequently ruled out and we took him up for surgery. We took out his implants, the femoral stem or the thigh bone stem, which was loose. So we revised only his thigh bone or the femoral side, because the socket side or the acetabular side was relatively well preserved. The surgery went well and his leg lengths were restored. He was about an inch and a half short, but post-surgery for the first time he said that his leg lengths were restored to his pre-injury levels. The patient started walking the next day with the help of a walker with full weight bearing as tolerated. He's about 3 weeks down the line and he's doing absolutely fine, and he's able to walk considerable distance with the help of a walker and will subsequently be able to walk without any support.
The staff were marvelous. The nurses, the daily checkups, daily rounds by the doctors, the cleaners and everybody else were marvelous. Really, really good people, very, very helpful in every way. If I had a small problem, just ring a bell and within seconds they'll be there. A lady called Kalpana, she's a physiotherapist and she would come every morning to make me walk. I had heard in the past that people were coming to India for treatment, but I didn't know that there was this Manipal hospital which is really a very good hospital. I would like to thank the staff, beginning with the doctors, the nurses, the master cleaners, and all other staff, the security men, for having looked after me so well and made my time really excellent.